doing my room scan. I have my supplies, my provider orders. Hi, I'm Hannah. I'll be your student nurse today. I'm going to perform hand hygiene and provide privacy. Can you tell me your name and date of birth?
Joe Smith, 10/5/53.
Do you have any allergies, Joe?
Sulfa.
All right, I would verify all of that on his wristband. And then I'm going to review provider orders. All right, Joe, it looks like I'm here to place an IV. Do you have any questions before we get started? It'll just be one small poke.
Nope.
All right, I'm going to go ahead. I will be wearing gloves later on in this video. I'm going to gather all my supplies. For the purpose of this video, we'll say that it's all intact and unopened. I have my sodium chloride. Everything's intact and it's not expired. And any IV fluids that we'd be using, we would label and date the time on it with initials. I have my IV start kit. It's not expired. Packaging's intact. I have my J-loop and it's not expired. Package intact. I have my AvoCath and everything's intact and not expired. And at this point, I'd be selecting the correct size appropriate for Joe, which would be a 20 gauge and 1 1/4 inch. And then Joe, are you in a comfortable position?
Yes.
All right, and then I have Joe in a dependent position with a barrier underneath of him. Now I'm gonna go ahead and open my supplies. And I have my tourniquet.
Next, I'm going to gather all my supplies. So first,
And open my J-loop and make sure that it stays in the sterile boat. And then I'm going to take my chloride again. It's not expired, and I'm going to break the seal, pull back, and then remove the cap. And then I'm going to get rid of any air. Alright, and then I connect the J-loop to the J-loop. And then I will go ahead and fill it until I see no more at the end of the line. Alright, and then I make sure that it stays within the boat to make sure it's sterile. And then I'm going to go ahead and get my tape. Alright, now I'm going to go ahead and place the tourniquet about 3 to 4 inches above the site I plan to use. And then I'm going to palpate and inspect the vein I'm going to be using. Alright, and then I'll remove the tourniquet. At this point, I'm going to grab gloves. And I will be cleaning the site I plan to use for 30 seconds with an alcohol prep pad. And then I would go ahead and leave it just above where I plan to use, and I would let that air dry. Again, I already selected the appropriate size for Joe, so now I'm going to go ahead and just open this. Alright, and now that it's been 30 seconds, or now that it's dried, I'm going to go ahead and place the tourniquet, and then remove the cap, and I'm inspecting to make sure that nothing is broken and everything looks okay. Now I'm gonna go ahead and Joe, you're gonna feel a small poke, okay?
All right.
And I make sure that I pull the skin back, hold it taut, and then bevel up at a 30 to 45 degree angle. I'm gonna insert until I have blood return. I have blood return, so then I'm gonna lower it to about parallel with the skin and advance the needle forward about a 1/4 inch, and then I will go ahead and slide it forward, and then holding it in place, I'm gonna hear the click and remove the needle and remove the tourniquet, and then stabilizing, I will go ahead and hook the J-loop. And while stabilizing it, I would go ahead and pull back for blood return. And I have blood return, so then I would go ahead and inject 10 milliliters of flush.
Now I'm ready for insertion. And I will insert the needle at a 30-degree angle.
And while stabilizing this, now I'm going to go ahead and place my Tegaderm and make sure that I just go right above the and remove this. I would also take the label off this. I would label it date, time that we inserted it, and then the needle gauge. And then now I'm gonna go ahead and place more stabilization, place my tape in a chevron shape. And then I'm gonna go ahead and clamp this and close it. And then I can go ahead and remove. And then I will go ahead and stabilize the rest of the way. I would go ahead and put my needle in sharps. All right. Joe, is there anything else I can do for you today?
No.
All right, I would dispose of all of my stuff, take off my gloves, and then I would wash my hands in the sink. For this video, I will be using hand sanitizer. All right, and I'm done.